Admitting all.
Good afternoon, everybody. We'll give everyone a second or two to join to audio. And welcome to the best practices for reopening, preparing for Orange Tier, hosted by the Office of Economic and Workforce Development and produced by the virtual outreach team of the COVID Command Center. And just as a note, we're not in Orange Tier yet, but we're going to get there. A little housekeeping. Language interpretation is available in Cantonese and Spanish. To enable language interpretation, click the interpretation icon at the bottom of your screen and choose the language channel that corresponds to your needs. We have Spanish and Chinese today. More housekeeping. Today's event is being recorded and streamed live on Facebook and YouTube. Audio and video, we respect all participants in this convening, and today we want to create a safe space for all. So by default, all participants will be muted and video is disabled. Video will be on for speakers only. And for chat, to participate in chat, please select the chat button at the bottom of your screen and send any questions to Q&A Catherine Daniel. Get Tested San Francisco. You can save lives and stop the spread of COVID-19 by getting tested through your healthcare provider. If you have if you have symptoms or have been exposed to COVID-19 but don't have health insurance or can't get tested through your provider, visit sf.gov/gettestedsf or call 311 for information on getting tested at a city-run testing location. A safe and effective COVID-19 vaccine, coupled with continuous preventative measures, are our best tools to end the COVID-19 pandemic and safely reopen San Francisco. Vaccines are free for those who live or work in San Francisco. Go to sf.gov/COVID vaccine for information on eligibility, vaccination sites, including locations, and links to book an appointment if available. San Francisco is currently in the red tier. We can only reopen safely as long as we all stay vigilant and wear face coverings and practice physical distancing. Keep it up, San Francisco. Now is the time to come together, San Francisco, because together we can stop anti-Asian discrimination, bias, hate, and violence. The COVID-19 virus has no race or nationality. It is simply a disease. To report a hate crime, please call SFPD at 415-553-1133. And just a reminder, today's event is focused on our small and local businesses. We realize we have press on today. And so if you are a reporter, we encourage you, if you have any questions regarding items within our event, to please send those to dempress@sfgov.org. And we'll be answering questions from our local small businesses today from our experts. Now, it's my pleasure to introduce, and here we have our agenda. Acting Director of the Office of Economic and Workforce Development, Director Ann Topier. Ann, the floor is yours.
Thank you, Trey, and thank you to the virtual Joint Information Center team for producing this webinar, and to everyone who has called in to join us today. I am Ann Topier, Acting Director of the Office of Economic and Workforce Development. We are pleased to host today's webinar in partnership with the Department of Public Health to provide the latest updates on reopening in advance of our anticipated move into California's Orange Tier. And we are very honored to be joined by Mayor London Breed, who will be able to speak to the progress we have been making recently. This is OEWD's second preview webinar aimed at ensuring that our business community has as much notice as possible about how we will reopen as we move into a new tier on the state's reopening plan. We know that businesses need notice of what's coming so that you can plan ahead and resume safe operations as soon as legally allowed. That has been a priority and clear directive from Mayor Breed that the city do whatever we can in order to respond to that need. As such, it is my honor to now invite Mayor London Breed to kick off this exciting reopening webinar. Mayor Breed.
Thank you, Anne, and thank you all so much for being here. I'm glad to be back with all of you today to talk about how we are going to get our city moving forward. Yesterday, we passed the 1-year mark of our shelter-in-place order, which I know has been far, far longer than any of us expected when this thing first started. And I know how hard this past year has been on our businesses and our workers. But the good news is we are seeing our cases and hospitalizations continue to decline. And we are also moving quickly ahead of our vaccination efforts. As of today, 34% of our residents over the age of 16 have received at least one dose of the vaccine. And that's true for 76% of our residents over the age of 65. And while we set a goal of hitting about 10,000 vaccines a day initially, we're starting to hit that goal. So now we are pushing towards a goal of 20,000 a day. We have the infrastructure to do it. Now we just need the supply. And what it means as we vaccinate more people and our numbers continue to drop is we can reopen more and more things in our city. This is why we are here. On Tuesday, we are almost certainly going to find out we are moving to the orange tier, which means on Wednesday, we can move forward with more reopening efforts. I understand that the reopening that we have planned for the orange tier is more than we've ever reopened at one time since the beginning of this. That is why this is great news, and I hope we can keep it up. Dr. Phillip is joining us today, and she will present the full list of what to expect. But let me tell you that I'm excited for how much momentum around this that we will see so much happening next week, that our offices will begin to reopen and what that will mean for our downtown. I'm super excited about that. We know it will take time, but our downtown is so important to the future of the city. It supports our economy, it supports our small businesses, and we're going to do everything we can to bring it back safely. We are also starting our first efforts to bring back the festivals and entertainment that are such a big part of San Francisco summers for the first time since we issued the stay-at-home order. And I hope we will have more in this area soon, because I'm dying to go to a concert to see some live music. And for those of you that are baseball fans who may be worrying, well, don't. We know the Giants opening day is coming soon, and we are definitely working on it. Bars and breweries can open outdoors for the first time in a year. Our family entertainment like bowling alleys, mini golf, and pool halls can begin to open indoors. And I hope our skating rink, Dr. Phillip, can open. You know, the Church of Eight Wheels is one of my favorite places to go to. And a whole host of activities can expand their capacities to do more business, serve more people, from restaurants to retails to gyms to youth sports programs to museums to cultural centers. I'm so excited for all the business, all of this, because of what it means for you and your businesses. But I'm also excited for what it means for our city. We are moving forward. 3 weeks ago, we were planning for red, and now we are looking at orange. And just because beyond that will be yellow, which we are quickly heading towards. But to get to yellow, we need to continue our partnership to open responsibly and make sure your customers and employees are following the guidance. I know it's hard, but it's so important. We will continue to practice the responsible behaviors that prevent harm to all of those that are not yet vaccinated and help protect us from any risky behavior. We need to move forward, but with an eye to the unknowns that this virus could still throw us at. And I know we can do that because of everything that we have done already. I'm so proud of what the city, what all of you have accomplished. I look forward to reopening next week, and I look forward to reopening in the yellow tier soon. More than that, I look forward to the San Francisco that is emerging right now, a city that united to beat back the first pandemic our country has faced in over a century, a city that will stand united as we get on the road to recovery. Look forward to working with you all to ensure that we are doing everything we can to support that recovery, and that like our response to this pandemic, we are acting with urgency and with a focus on equity that will support the success of everyone in our city as we move forward. Thank you all so much for joining us. We're so glad to provide you with this update, and I will turn it back over to Ann Topier.
Thank you, Mayor Breed. Your leadership, commitment to listening to experts, and dedication to supporting San Francisco's business community has allowed our city to come together and manage the pandemic so that we are where we are today. And where we are is in a very good place. Just 3 weeks ago, we were preparing for a move to the red tier after a long winter of sliding backward. Now we are positioned to move forward quickly along a reopening timeline. We expect to move into the orange tier next week and very possibly into the yellow tier as soon as 3 weeks later. With this momentum, I am hopeful that we can begin to make significant progress toward meaningful economic recovery. And OEWD is looking forward to partnering with our business community in order to support those efforts. So before I turn things over to Dr. Phillip, I want to congratulate and thank all of you who are on the call. Your work, your sacrifice, and your partnership have allowed us to get to this point. Your commitment to following the health orders, operating safely, and doing your utmost to protect the health of your employees, your customers, and the public is showing up in our falling case rates. Your innovation and resilience is in finding new ways to operate safely despite the restrictions is allowing us to move into orange soon and hopefully into yellow shortly after that. We don't expect that things will return to what was normal before the pandemic. San Francisco has changed, and some of those change will last. We will activate our neighborhoods and do more outside. We will respond to new markets and new opportunities. We will work to streamline permitting and allow for more creative uses in commercial space, both of which are core elements of Mayor Breed's recently introduced Small Business Recovery Act. What we have seen over the last year proves that our business community can come together and respond to these changes. And that means our businesses and San Francisco as a city is well positioned for the future. You are essential to realizing a strong and fair economic recovery. That is why OEWD and the city want to ensure that you have the information you need to reopen quickly, operate safely, and respond to these changes. I want to highlight our website, oewd.org, where you can find all of the most recent information about reopening and what is and is not allowed. You can also find information and links to resources such as grants, loans, and supportive programs for businesses, workers, and nonprofits. We have listed as many of the resources available to you at the local, state, and federal level that we could find. Please check it out. If you have questions about any of the information, we've included, you can reach out to our small business and worker hotlines, where you can speak to a real person and get personalized assistance. And now to the matter at hand. Today's Preparing for the Orange Tier webinar will include a presentation from Dr. Susan Phillip, the city's health officer, who will speak to our health indicators, our vaccination progress, and the activities that we expect to reopen under the Orange Tier. We will also hear from Dr. Patrick Fosdahl from the Environmental Health Branch of the Department of Public Health to explain the city's enforcement of health regulations. After the presentations, we will have time for questions and answers. Please send your questions through chat to Q&A for them to be answered live. We are joined for Q&A by a few of our city's leaders who can answer questions about support programs, including OEWD's Diana Ponce de Leon, who can speak to resources and support available to businesses, Robin Abad, Director of the Shared Spaces Program, and Caitlin Acevedo from the city's CERT team. Please note that because this is a preview to reopening, it is always possible that things might change with regards to either our health indicators or the rules that guide us between now and then. We do our best to give you as much information as possible so you can plan accordingly. But as the city moves into a new tier of reopening, you will need to check the health order to confirm the rules that guide your sector. With that, I want to hand things over to Dr. Phillip to walk us through where we are and what we might expect once we move into the orange tier. Dr. Phillip.
Thank you so much, Director Topier, to you and your entire team at the Office of Economic and Workforce Development, to our colleagues at the Virtual Joint Information Center for the city, and to Mayor Breed for her really excellent framing of the topic at hand. As we move forward with excitement and with a shared sense of responsibility for making sure that we can continue in this good path that we're on. So today, I know everyone is here to talk about and to hear about Orange Tier and what we will be able to reopen and what we'll be able to do. I think it was so great that we were able to come together to talk through Red Tier, and very happy to be invited back to speak with you again. Next slide, please. So the good news, as Mayor Breed announced, is that we're doing well as a city, and our case numbers are coming down because of the efforts of everyone in San Francisco, residents, employees, business owners, all of us together working to bring this curve down. So from a peak of 375 in early January, average cases per day, we've come down to a tenth of that. And that is a remarkable testament to everything that we have been doing as a city. Next slide, please. We also have seen that we are progressing through the tiers, and I know this is very exciting to people because it means that more sectors of our economy and our city and our lives are reopening and becoming closer to what they were pre-pandemic. And while we're not there yet, all of this movement is encouraging and great to see. So this is the same curve as we saw on the previous slide, but now we've superimposed some of the time points and the markers. So as we know, we moved officially into Red Tier on March 3rd, and we are anticipating, as the mayor said, that we will move into Orange Tier on March 24th, next Wednesday. And cases, continue to be low. We have to be cautious though, because as we reopen, we are coming into closer and closer contact with each other, more and more opportunities for transmission. But we know how to stop that transmission by now. We're experts at masking, at distancing, at following the guidelines and the procedures. The other thing I'd like to point out is that this curve is coming down, but throughout this pandemic in San Francisco, as is true in California and the United States, this pandemic has not impacted all of us equally. There have been significant disparities geographically, where the eastern and southern parts of our city have been most impacted, and all of our communities have also not fared equally well. And for our Latino community members, for Black African American community members, for Asian community members, the rates of infection or death have been higher. So we must keep this in mind as we are seeing our cases come down as well. We need to continue this good outcome for all of our communities to be well and healthy. Next slide, please. And so, the caution is, the excitement is that we're moving forward, and I'm so happy to be able to say that and to be able to have this conversation about Orange Tier. But we're not out of the woods yet. I think that's a very important concept to keep in mind and to continue working through as we move from red to orange. The decline in cases is very encouraging. I can't overstate how encouraging it is. But we have a lot of reasons that we need to continue our caution. So we can do both things. I know we can. We can continue to reopen, continue to do more activities, but maintaining the activities and the behaviors that are going to allow us to continue to progress with health for all of us in San Francisco. We have heard about coronavirus variants, these random mutations that can occur in the virus, And then every so often, randomly, it can actually lead to a virus that transmits more easily or that can make people more sick. These remain a wild card. And there are variants that have been identified in San Francisco and in the Bay Area. And we've heard about these from the media. We've heard about the UK variants. We've heard about the so-called South African and Brazilian variants. And there are also West Coast variants that seem to have arisen in the United States themselves or become more predominant over time. And the CDC is tracking and identifying those. Now, the reassuring thing in San Francisco is that we have not seen our hospitalizations or case rates increase substantially, but we have to keep an eye on this. And the Department of Public Health, we're watching these data very closely. The reason we have to be much more cautious, and people have asked me, it's a very reasonable question, why can't we just do what California says we're able to do? Well, the reason is, remember that California encompasses a wide variety of places, from San Francisco and Los Angeles to very rural parts of the state. We are the second most dense city in the United States. That means that there are many more opportunities for the virus to transmit from person to person if we don't take extra care. And that is one of the principles that we followed throughout this process of getting through the pandemic and then reopening. And as we open up, we have to continue to follow protocols, as the mayor has said, to stay masked, to continue testing when needed. And that combination of moving forward with hope and optimism and being glad that we can do that has to come with these cautions. Next slide, please. Another key, again, to our feeling confident as we reopen is vaccination. And it is an amazing thing that we have come so far in just a year to now being able to talk about a vaccine to protect us in San Francisco and elsewhere around the world from severe illness and death from COVID-19. And it is really remarkable that we're here. And it is remarkable how well San Franciscans have come forward to be vaccinated, as we have set up very robust systems across the city. And the percent in San Francisco over 16 who received at least one dose as of this morning is 35%. And it's even higher than that, 76% for people who are age 65 and older. So this is all very, very good news. And it gives us confidence as we're reopening that we will not see a return of the very, very high levels of hospitalization and an increase in deaths. But 35% having received one dose and 17% having received full vaccination is still not the majority of our residents in San Francisco. And so we are in this in-between time where we will get there, we will get to herd immunity, and we will do it as fast as we can with the capacity that we've built in the city and the willingness and the know-how of people who are coming forward to get vaccine and partnering with us to help get vaccine to people who might not be able to come to our conventional sites. But we continue to have to be careful in the meantime. Next slide, please. So for all of you as employers, as employees, please support each other, support the people that work with you and for you to get vaccine once they are eligible. And we have several routes, many routes where people can get vaccine, including through their own healthcare providers and their systems if they prefer. But people can go to sf.gov/getvaccinated to find out more about options for vaccination and to schedule an appointment as well. And these are the people listed on the right here who are currently eligible for vaccine as of this week. And it continues to be healthcare workers, people who are 65 and older, workers in many different sectors, which may include the work that some of you are involved with. So again, realizing that your employees may be eligible for vaccine and helping them do that is so important. Also, persons experiencing homelessness, people that are living and working in certain high-risk congregate settings, and people with some health conditions or disabilities or who are experiencing homelessness. And the full list and further explanation is available on the SFGov website under Get Vaccinated. Next slide, please. So having said all that as preamble, I know people wanted us to move to talk about what is going to be permissible in the orange tier. So let's move to the next slide and start that discussion. Our goal, as always, as we talked about with red tier opening, is to align as much as we can with what the state allows. But again, we talked about the fact that San Francisco has to be slightly more cautious and have additional safeguards so that we limit the spread of the virus in our very large and populous city. Our approach continues to be focused on expanding activities outdoors compared to indoors, because outdoors is safer with a respiratory virus. The air just naturally diffuses the virus and provides that optimal ventilation that limits the spread from person to person. We also want to make sure that we are considering all the sectors. So any one sector may not be able to have all of the opening that they would like, but we think by allowing everyone to progress a little bit, we'll be able to continue to move forward together. And we always do assess the limitations as we continue to move. And we are hopeful that we'll be talking about yellow tier in a few weeks, but it's not a 100% guarantee. And we will all, again, have to try our best to get there together. And we do expect, though, that we will be assigned to the orange tier next Tuesday, and that 8 a.m. the following morning, we will go into the orange tier. Again, all the caveats, this is subject to change, what we're going to talk about, but you will be able to see the full guidance, directives, and order when they are issued at the time that we are announced and that we will transition. Next slide, please. So in terms of singing, chanting, playing wind instruments or brass instruments, if that's happening outdoors in whatever setting, it's allowed if someone is wearing a face covering and is 6 feet away from people in other households. The face covering or an instrument outdoors, or instrument covers outdoors, can be removed as long as people remain 12 feet away from other households. But we do encourage people to continue wearing the face coverings and using the instrument covers if they can. There's no cap on the number of performers, event leaders, or other people who can sing, cheer, etc., playing a wind or a brass instrument, but it is subject to any specified capacity limits for the activity. Next slide. Okay, so if we're talking about indoors, the same types of activities, singing, shouting, chanting. Again, we know that forceful breathing, shouting increases the chances of transmission. That becomes even more so indoors. So due to the ongoing risk, this is strongly discouraged in indoor settings. However, people may sing, cheer indoors as long as they wear a face covering and remain 12 feet away from others. Nobody can sing or cheer, etc., without a face covering on indoors. People may play a wind or brass instrument indoors with an instrument cover as long as they remain 12 feet away from other households. Nobody can play a wind or brass instrument without an instrument cover. And there's no cap at this time, but performers count against the total occupancy limits indoors. Next slide, please. Okay, if we shift to retail, grocery stores, and food courts, retail can open with a capacity of 50% of maximum occupancy, and this is based on just the patrons, not the staff. There's no eating or drinking allowed in the stores. Essential retail is urged to have special hours for unvaccinated older adults and people who are vulnerable. Indoor food courts can also open at 50% capacity with a maximum of 200 people. And food courts must meet one of the DPH-approved ventilation measures and implement a system to monitor entry of patrons and to follow all the safety protocols. So no longer is there a prohibition on store personnel touching a customer's reusable bags or other reusable containers, subject to any existing state restrictions, but our local restrictions are removed in orange tier. Next slide, please. So for dining, outdoor dining, the existing rules are carrying forward. So just as a reminder, there's no percentage occupancy limits for outdoors. The tables are generally required to be spaced 6 feet apart. The barriers between the tables can continue under certain circumstances if they were pre-existing. And there does have to be signage posted that describes the spectrum of dining risk, namely that outdoors is safer than indoors. And for people who are unvaccinated and with certain medical conditions, they might want to consider deferring dining at all at this time. But some new items for outdoor dining is that it's going to be 6 people per table, but there's no household number limit on that. 2 table reservations are permitted at the same time, but the guests are not to mingle between the tables, regardless of whether they're from the same household. So we really want that group of people that are potentially 12 people at 2 tables of 6 to stay seated and in their own spaces and at their own tables. Dining establishments can now serve alcohol without a meal, following the safety protocols for outdoor bars. And live entertainment is allowed with singing and wind and brass instruments per the general safety rules for such activities that we just covered. Next slide, please. For indoors, again, existing rules carry forward with table space 6 feet apart, implementing 1 DPH ventilation measure and displaying a placard at the entrance showing which one that is, and then posting again signage describing the spectrum of dining risk. Indoors, dining indoors will now be allowed to happen up to 50% occupancy based on patrons only, but not more than 200 people. Tables are limited to 6 people, and these can be from up to 3 separate households. Front of house staff who interact with the patrons are required to wear a well-fitted mask. Television is allowed. Live entertainment is also allowed with singing and instruments per the rules for such activities indoors. Indoor dining must close at 11 p.m. This is an extension of 1 hour from the previous 10 p.m. And we're lifting the 2-hour limit on seating. Next slide, please. So bars are now able to operate outdoors. They can open outdoors only with table service, no more than 6 people per table, in accordance with the same safety protocols that apply to outdoor dining. They no longer have a requirement to serve bona fide meals. Patrons must be seated at a table to be served and can consume their beverages only at the table. 2 table reservations are permitted, just as for outdoor dining, but guests, again, may not mingle between the tables, regardless of whether they are from the same household. And this includes wineries, breweries, and distilleries, in addition to bars for outdoors. Next slide. In terms of arts, music, and theater performances and festivals outdoors, these are open for organized and supervised events with up to 50 people in attendance, with face coverings and distancing. Food and drink will be allowed while seated only in groups of no more than 6 people and 6 feet away. The groups have to be 6 feet away from other groups or other people. Patrons, personnel, and performers are subject to the general safety rules regarding singing, shouting, chanting, cheering, and playing wind and brass instruments that apply outdoors. And the organizer has to submit a health and safety plan to DPH in advance, but approval of that plan is not required in order to proceed. Next slide, please. So for fitness classes and gyms indoors, indoor gyms can open at up to 25% capacity based on patrons only. They're open for group cardio or aerobic classes, as well as hot yoga or similar group classes at up to 25% capacity and no more than 100 participants total in the space, as long as all instructors and participants wear face coverings at all times and maintain 12-foot distancing between households. Implementation of at least one of the DPH approved ventilation measures is strongly encouraged in the exercise area and throughout the facility. Indoor locker rooms and showers may open and must implement at least one of the DPH approved ventilation measures in those areas. Patrons may remove face coverings when showering, but must wear them at all other times. And San Francisco's restriction on using indoor gyms and fitness centers is lifted. Next slide, please. Outdoor fitness classes and gyms are open with safety modifications, including distancing and face coverings. Gyms and fitness centers outside must also sanitize between users. The limit that we had of 25 participants in a class is now lifted in orange tier. There's no special capacity limit other than what's required for minimum 6-foot distancing. Outdoor pools are open at 50% capacity with distancing requirements. Next slide. For hotels, many of the same requirements that we just talked about with gyms, fitness centers, and dining applies. Indoor gyms and fitness centers and hotels can open at 25% capacity as long as personnel supervise their use by guests to help ensure compliance with safety protocols. Ventilation measures are strongly encouraged but not required in the areas where people are exercising, and where face coverings are required at all times. Indoor locker rooms and showers in these facilities also may open under the same protocols that apply in gyms and fitness centers generally. Indoor saunas, steam rooms, and hot tubs must remain closed per state rules. Next slide, please. For indoor youth sports, dance, and exercise, it's allowed if it's part of an organized and supervised youth sports system for indoor low contact, such as singles tennis, bowling, swimming, gymnastics, moderate contact, such as volleyball, squash, dodgeball, kickball, doubles tennis, and high contact sports, such as basketball and martial arts. Capacity for indoor recreation facilities is limited to 25% occupancy up to 100 people. And capacity for indoor activities is further limited to stable cohorts of up to 16 youth participating in the activity, including coaches and staff. And there are similar guidelines for adult recreational sports as well, which will be shared fully in all the documents that will be released. Next slide, please. Personal services are open indoors at 50% of maximum occupancy based on patrons only. Mask removal precautions for patrons continues as it was in the red tier. So patrons may temporarily remove face coverings if the care provider providing the service wears a well-fitting mask and the service is provided in a separate room or at least 6 feet away from others. And 1 DPH ventilation measure is implemented in the indoor area where the service is performed. Next slide, please. For zoos, aquariums, and museums, indoor and outdoor, our zoo is allowed to fully open with a safety plan that's been approved by us, DPH, and the health officer. Indoors, they can open at 50% capacity based on patrons only under an approved safety plan. Indoor food and beverage is allowed with the capacity limits, ventilation requirements, and subject to the same protocols as indoor dining. Interactive exhibits are allowed with sanitation, distancing, and other safety protocols to ensure hand hygiene. And coat and personal property check services are allowed with sanitation, distancing, and other safety protocols. Next slide, please. For movie theaters indoors, they can now operate up to 50% capacity based on patrons only, up to a maximum of 200 people. Patrons of up to 3 households, up to 6 people, may purchase tickets to sit together and eat or drink. Food or beverage concessions inside movie theaters may open if there is at least 6 feet of distance from all other patrons, there is service to patrons in their seat consistent with indoor dining rules, or patrons purchase their food and beverages and consume them only while in their seats. The operator implements at least one of the DPH approved ventilation measures, and the operator provides a safety monitor to help ensure compliance with all of these requirements and post caution signs at the public entrances. Next slide, please. For offices, for non-essential workplaces, those offices can open up to 25% capacity, but workers who are able to telecommute are still encouraged to do so to the greatest extent feasible. Businesses with fewer than 20 personnel must reduce their maximum occupancy to the number of people who can maintain at least 6 feet of distance from each other in the office at all times. Capacity in conference rooms is capped at 25% of the maximum occupancy of that room based on all people in the room. Next slide, please. And in terms of other activities, indoor family entertainment centers can open at 50% capacity, and this is counting patrons only, not staff, for naturally distanced activities per the state guidelines. This could include activities where people can maintain distance, such as bowling alleys, billiard halls, and indoor miniature golf. Arcade game centers, ice and roller skating rinks, and indoor playgrounds, unfortunately, are not allowed at this time in the orange tier. Open air boat operators like tour boats or fishing boats and open air tour bus operators are open in outdoor areas only. If there are more than 25 passengers, they must be physically separated in groups of up to 25 passengers maximum. And for drive-in events, drive-in movies, and drive-in performances, these are open for movies and limited live performances with up to 100 vehicles and 1 household only per vehicle. We've lifted the 6 performer limit. All other requirements for live performances apply. And there are other activities that are not listed here. There will be much more full description of the requirements outlined in the order, the directives, and the guidelines that will be available to you all. I want to emphasize again how important it's going to be to maintain compliance as business owners, as employees, as residents, for all of us in these activities. And compliance and enforcement are increasingly important and will increasingly happen in order to ensure that we do not have to move backwards. We want to continue to move forward together. And so I'm very pleased that Director Fosdal will be speaking with us about compliance efforts as well. Next slide, please. And that is all I have. As I said, you will be able to see the full order, directives, and guidance when they are issued. And we look forward to Orange Tier. Thank you again, as Mayor Breed said, for all of your cooperation. And as Director Topier said, for all of your great work to get us to this point. It's very exciting. We know that we can continue to keep moving forward together. And so very glad to partner with you in this important work that you all are doing of creating economic, social, cultural vitality in our city, which is critical to people's overall health and well-being, we know. Thank you very much.
Thank you, Dr. Phillip, for that information and also for the incredible leadership and responsiveness that you have shown in this role. We really appreciate all of the work that you have done to respond to the business needs and partnering that with the health guidance. It's really been incredible. OEWD has heard many questions from businesses about how the city is monitoring and enforcing compliance. And we wanted to give you a clear understanding from the team that leads compliance as well. So I would now like to ask Patrick Fosdal from the Department of Public Health to give us an update on the city's compliance efforts. Patrick.
Yes, thank you. Thank you, Ann and Dr. Phillip. That was a jam-packed full presentation with a ton of information. My name is Patrick Fosdal. I'm the Acting Director of the Department of Public Health's Environmental Health Branch. Just by way of background, the Environmental Health Branch is the regulatory branch for the Health Department, and it's made up of about 150 staff and around 30 different regulatory programs. Before COVID, we were tasked with enforcing the San Francisco health codes. Post-COVID, we've added the enforcement of the health orders and directives. Next slide, please. When the health orders first began to be issued, which, as the mayor pointed out, was about this time last year, we moved from a strictly enforcement orientation to more of an education-first approach. This was in recognition of the fact that complying with the changing health orders was very new to our business community, and there was going to be a certain level of confusion. To address this, the city formed the Community Education Response Team, or CERT, whose primary role initially was to educate and provide needed PPE to the business community. CERT is made up of employees from the Entertainment Commission, along with staff from a few other city departments, and you may have been visited by them in the last few months. We also sent out email blasts to our permitted businesses, provided guidance documents around compliance, sent out staff to conduct compliance checks, and participated in webinars like the one this evening. Over time, the health orders, the health order enforcement team has evolved into a collaborative effort between CERT, DPH, and the city attorney. Jennifer Johnston from the city administrator's office is currently coordinating this multi-agency effort. She's also involved in another multi-agency effort around compliance issues at the many permitted shared spaces here in San Francisco. And this group includes the fire department, public works, planning, and members of health. You can see the enforcement tools listed there. The way the health orders are written, they include penalties, including fines and jail time. However, up to this point, we have not issued any fines and have used notices of violation and facility closures to gain compliance. The health orders allow for closures up to 2 weeks or until the next tier, so it can be significant. Next slide, please. Up to this point, the Department of Public Health has performed around 6,600 compliance inspections since the beginning of the pandemic, and we've issued citations to around 1,500 businesses. So this translates to roughly about 23% of those inspected. So there have been a fairly high rate of businesses complying, with the health orders. And this is something we'd like to see continued as we reopen. And we want to thank all of you for your participation in that. You can see listed there some of the most common violations, and we have closed somewhere around 24 to 30 businesses temporarily. Next slide, please. So what has happened in terms of the health order enforcement since we moved to the red tier on March 3rd? During the last 2 weeks, we've conducted around 230 compliance inspections during normal business hours, and we performed around 40 or so compliance inspections during the after hours and on the weekends. So again, if people are under the impression that we're not around on the weekends, we are. And as was expected with the tier change, we are finding a higher number of violations. So of the 230 or so inspections conducted, about half were found to have had violations. Well, most of these violations were around new posting requirements and signs and adequate safety plans and so forth. However, we did find a handful of businesses operating unsafely. And when this happens, the business needs to be closed until they can make changes which would allow them to reopen safely. We hope not to have to do this very often. Unsafe operations include large indoor crowds with lack of the required face coverings or social distancing. As Dr. Phillip pointed out, we're particularly focused on what is going on indoors, since that is a better transmission point for the virus. In addition, since going to the red tier on March 3rd, we've temporarily closed 2 businesses during the last 2 weeks. As we look forward to the further reopening of the city under the orange tier, we're hopeful that we will see a high rate of compliance with the new and less restrictive orders that Dr. Phillip just described. I just want to close by acknowledging that this has been a very long and difficult year for all of us, and especially for the small business community. It's often felt like running a marathon and running it with no end in sight. Well, we're finally starting to get some good news with the vaccine being rolled out, and the key health statistics are all looking very encouraging right now. Having said that, as Dr. Phillip pointed out, we haven't crossed the finish line yet. The only way that we're going to get to that finish line is by continuing to do what has gotten us this far. As we move to the orange tier next week, it is just as important that you continue to follow the health orders and directives, even if you've been vaccinated. Since the first health order was implemented, it has been the tremendous spirit of cooperation between the business owners and the Department of Public Health around compliance with those health orders that has gotten us this far. So please continue to do what you do every day as you serve on the front lines of this pandemic by ensuring that the health and safety of your employees and customers is there every day. Only working together are we going to be able to reopen safely. Thank you. And at this point, I'm going to turn it back over to Ann, I think, for a question and answer session.
Thank you, Patrick. We appreciate you presenting today. If we are going to continue to move forward, it will be incumbent upon everyone to understand and follow the rules so that we maintain our current health trends. So now we are going to start the Q&A through the chat function. We already have quite a few questions in the chat. So if we do not get to answer your question today, please email your question to marianne.thompson@sfgov.org. That's marianne.thompson@sfgov.org. And if you are a member of the press, please send your inquiries to dempress@sfgov.org. As I mentioned, in addition to our partners from DPH, we are joined by Caitlin Acevedo from the CERT team, Robin Abad, Director of the Shared Spaces Program, and Diana Ponce de Leon, the Director of OEWD's Invest in Neighborhoods. So with that, I will start reading through some of the questions from the chat. I do have a couple questions for Dr. Phillip related to community centers. I think some of these questions were answered in your discussion about what you could do related to yoga and other activities inside community centers. There is a specific question about returning to classes with older learners at senior centers, libraries, community centers. It says for our city contracts, will there be vaccination requirements both for the learners and the trainers?
Thank you for that question. We know that classes and being able to have people come together to learn and for activity is really important. So classes will be able to resume indoors with spacing. There's not going to be a specific vaccination, requirement. We want everyone to want to be vaccinated and to offer vaccine to everyone, but there's no mandated vaccination. So we are anticipating that the activities you mentioned, classes and those types of activities will be able to occur with distancing and spacing requirements.
Thank you. I have another question about outdoor gatherings. And again, I think it asked about capacity limits of indoor and outdoor gatherings. They specifically asked if there are any guidelines for school graduations.
Thank you for that, and stay tuned. The state is going to specifically come out with large gathering guidance, and we're told that will happen soon. And specifically, they are going to be coming out with commencement and graduation guidance as well. So we'll be looking for that, and we will adapt from that. But we know that's an issue that we'll need to keep our eyes on. So more to come soon on that.
And then I have two more for you, doctors, and I think I'm going to ask Caitlin a question. One question is a question about travel quarantine update during the orange tier. And then the second is, I keep hearing that the rest of the USA has plateaued for COVID cases. Are we not seeing the same thing in San Francisco?
Now, thank you for those questions. So for the first point, we do not have a mandatory travel quarantine under a health order any longer. That had been in place previously and has been lifted. Having said that, I still really want to encourage people to limit non-essential travel right now. And that is still a national CDC recommendation to not travel at this point. But we are getting there. We're getting closer to where it'll be safer to do that. But right now, we would urge people to limit their travel to about 100 to 120 miles away from San Francisco and try not to go further than that. And the second question, could you remind me again, Director Topier, what that was?
That their persons experiencing plateauing. Yes.
Thank you. So yes, that there's a concern that is happening in some states in the United States, that they're seeing a flattening of their curve and they're not continuing to go down with cases. And in some cases, there's even been a slight uptick. And, as we know, it's been very difficult and painful to be so cautious here in San Francisco and in California overall. And there are other states that are taking different approaches. And that is concerning. We are not vaccinated enough as a country, as a state, as a city to continue to do that. And that is one of the reasons why we want to continue caution, right? We don't want to have to go backwards, but if cases go up significantly, if hospitalizations do again, we will have to reassess at that time.
Thank you. I'm going to ask a question. I think this is for Caitlin about documentation from the city needed to be secured prior to reopening. Someone is saying they'd heard that we needed to be certified to reopen and or to file our planned protocol with the city. Is that true?
Thank you for the question. I actually don't believe that that's meant for the CERT program. Perhaps that would be better answered by Director Fosdal. The CERT program does not look at the type of certification of paperwork.
Thank you. Sorry about that, Caitlin.
That's okay.
Yeah, thank you for that question. Yeah, you don't have to submit the health and safety plans to us. They do have to be on site, functioning, being used, and that is something that we're going to look for and check for when we come out and do inspections.
And also, Dr. Fosdal, there's another question about offices, non-essential offices being able to open. If we move into orange on the 23rd, will they be able to open on the 24th?
Yeah, I think Dr. Phillip covered some of that in her presentation. There's a percentage limit on that. I believe 25%, if memory serves correctly. But yeah, that would happen on that Wednesday. Yep.
Yes, I agree. And I just want to add that, like last time, we anticipate that the new orders and all the information will be issued on Tuesday, the 23rd. It will become effective on the morning of the 24th.
Thank you. So I think a lot of, we have a lot of questions about being able to participate outside events. And I think quite a bit of this covered. Are any news on pools? I think you hit outdoor pools will be opening. Low impact exercise in pools for seniors, which I think, again, my understanding, Dr. Phillip, is that outdoor pools opening, I think you said 50% capacity?
Yes, there was a lot in there. So that was a great catch, Dr. Tobia. And indoors will be open as well at less capacity. And yes, we do anticipate that those types of low impact activities will be able to occur with spacing.
Great. And so I think we are just at about time. I'm sorry, I was not watching the clock there. So I thank you so much. And again, if you did not get your question answered today, or if you have questions, please email them to marianne.thompson@sfgov.org. And I just wanted to take a minute to thank all of our participants for their time and questions today, as well as our presenters and speakers. We look forward to reopening together soon. And so thank you very much to everyone for participating today. We couldn't do this without you. Thank you.